Everyone, welcome to today's ECHO session. I'm Kathleen Wellman. I'm the program coordinator and ECHO lead for the Constellation Regional Collaborative. I am joined today by Maxine Arena. She's our program manager. She's not feeling 100%, so I'm going to go ahead and take over for her today. And Sydney Fleming, our outreach and community engagement specialist. With this ECHO presentation, Sydney will be supporting the chat throughout the session. So if you could go ahead and put any questions or comments, if there are any in the middle of the presentation, put those into chat. Sydney will be watching those for us. We are so excited to dive into today's discussion. Let's take a quick look at the agenda to get us started. So we're going to go ahead and start with a quick round of introductions to help us know who's in our virtual room here. Then we're excited to welcome Kelly Duane from FoodShare South Carolina for our didactic presentation. After that presentation, we're going to go ahead and open up the floor for questions and discussion. We encourage you, like always, for participation. And that's where that the power of ECHO really comes in through that peer learning and the sharing and discussions across all the disciplines that we have here. There will be the post-ECHO survey that will be popping up at the end of the ECHO presentation. And that just helps us to improve the ECHO and tailor these sessions to your needs. We're going to go ahead and get started with these introductions. So today we're going to ask our attendees to please share the following in the chat: your name, your employer organization, and your position or credentials. If you could please go ahead and enter that into chat, and I'd like to go ahead and get started sharing our ECHO series subject matter experts. We have with us today, first person on my list is Dr. Donald DePetty.
Well, thank you, Kathleen, and welcome everybody. My name is Don DePetty. I'm here at the University of South Carolina, School of Medicine in Columbia, South Carolina, where I'm the Health Sciences Distinguished Professor and former Dean of our medical school. I'm also a member of the Constellation Quality Health Board, and I'm a practicing internist, a general internist that's specialized in hypertension and vascular diseases. And in addition, I'm a senior advisor to the Pan American Health Organization and the World Health Organization regarding the Global Hearts and the Hearts is in America's program. I am really looking forward to Kelly's presentation. I have had the honor of following FoodShare from its imagination on a napkin to now statewide. So Kelly, I'll just already preface this. Congratulations, and I cannot wait to hear where we are now with the program.
Thank you so much.
Thank you, Dr. DePetty. And I do have to say that Dr. DePetty and Emily Ridley are the reason why we got FoodShare South Carolina. They were the ones that recommended that we talk to you guys. So thank you so much. And with that leading in, Emily Ridley, you are the next person on the next SME on my list. If you could go ahead and introduce yourself.
Good afternoon. My name is Emily Ridley. I am a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where we serve primarily a low-income, urban, and also rural population of patients. I've worked in this health system with quality improvement efforts regarding hypertension. Also, I've served as a consultant with PAHO with the Hearts in America program, and we have many patients who utilize the FoodShare program, and we promote it all the time. So really looking forward to the presentation today. Thank you.
Thank you, Emily. We do have a few SMEs that weren't able to join us today. Dr. Jeffrey Bretler, he is out of Kaiser in California. Honey Estrada is She brings firsthand insight from the community health worker field, and she's a strong advocate for health equity. We also have Dr. Daniel Lackland, who is a recognized leader in hypertension and cardiovascular health research and policy. And then Monty Robertson, who provides expertise in system level implementation and healthcare quality improvement. So we are super excited to have everybody. I would love to introduce you to Kelly. She brings both culinary expertise and deep public health commitment to her work. Kelly currently serves as the Director of Culinary Medicine at FoodShare South Carolina, where she joined in January 2024 through the USC School of Medicine, Columbia. In this role, she launched a 3,000 square foot teaching kitchen to expand culinary medicine programs across the state. Just an incredible effort to bridge food and health through hands-on learning. Her background includes work as a SNAP Ed nutrition educator and the founder of a grassroots food literacy initiative focused on underserved communities. With over 15 years of experience in recipe development, food service operations, clinical nutrition, and community education, Kelly is passionate about building health through food literacy and advocating for food justice. She's currently pursuing her Master of Public Health at UNC Chapel Hill. We're thrilled to have her with us today to share her insights on how culinary medicine can support chronic disease prevention and health equity. Welcome, Kelly. I'll turn it over to you.
Thank you so much, Kathleen, and thank you again so much for having me here. This is such an honor. So I really appreciate y'all having me and for joining this presentation. So I am going to go over FoodShare South Carolina does a lot. So there's a lot of ground to cover here. I'm going to try not to talk too quickly because sometimes I do. So if anybody needs me to slow down, please feel free to throw something in the chat. My feelings won't be hurt. It's just a lot of ground to cover, and I want to make sure that we leave plenty of time at the end for questions and discussion, because that's my favorite part of these things. So I'm not really a lecturer. I like the discussion part. But anyway, as Kathleen said, my name is Kelly Duane. I am the Director of Culinary Medicine here at FoodShare South Carolina. We are a program of the USC School of Medicine. I'll go into that a little bit later in the presentation, but it's such a cool sort of, we're not quite a nonprofit, though we operate like one, but I love the community focus of FoodShare within sort of a more traditional academic structure. That's one of the things that drew me to FoodShare in the first place. So let's dive in. So our vision is that all South Carolinians will have access to healthy, fresh produce in their community. There's a number of ways that we facilitate that. The primary one and the flagship one being our Fresh Food Box program that I'll talk about here in a second. But ultimately, like, our vision is for all South Carolinians to have access to that fresh produce. Our mission to improve the well-being of South Carolinians by partnering primarily with communities and working at a community level to create those opportunities that strengthen access to healthy, fresh produce. We can go to the next slide. So our values, I'm not going to read all of these to you, but you can certainly go check out the slides on the online portal after this. But ultimately, our values are food, like food equity, food justice, equity, and that's not just food equity, but health equity as well, and equitable health outcomes through food, health and well-being. Good food is directly connected to good health. Relationships and community, we take our communities and our commitment to our communities very seriously, and we try to work at the community level whenever possible to make sure that we're providing relevant access to our communities and that everything we're doing really works for the communities that we work in. And then innovation and creativity. I love the Fresh Food Box program and everything that FoodShare does because it is really innovative, and we're constantly pushing to try to find more innovative solutions and get even more creative. As we know, sort of the food access landscape is always changing, and we really want to make sure that we're changing with it and we're nimble and adapting, with whatever is happening, like on a policy level on down. Next slide. So we do all of that through a number of programs that I'm going to go through here. So again, the ultimate goal is bringing that fresh produce into our communities, in the interest of food equity. So we do that in a number of different ways. So we can go to the next slide. And so our flagship program is the Fresh Food Box. Dr. Ridley alluded to the Fresh Food Box earlier, saying a lot of the patients that she works with at Prisma do order our Fresh Food Box. So what that is, it is our flagship program, and it is exactly what it sounds like. It is literally a box of produce. It is 9 to 11 varieties of produce. It's usually about 15 or 20 pounds. We include recipe cards in each box. So if you end up with a piece of produce maybe that you think you don't like, or that you're not used to working with, we do provide recipe cards with tips and ideas for how to use that piece of produce. All of the boxes, we distribute them on a bi-weekly basis. They are all different. So they follow the same general framework, but the products inside the boxes change every time. We take very seriously variety, and we want to make sure that our customers, don't get bored and don't get tired of their boxes. So we always try to change it up for them and make it fun for them. There's always going to be a leafy green in the box. There's always going to be some kind of potato or like a starchy vegetable. There's always going to be an onion variety. We do have a hand of bananas in every single box. That is the one thing that never changes. We'll usually have an apple variety of some sort, and then some just staple veggies like mushrooms, carrots, things like that. And then we always have a challenge or a premium item. So that's going to either be something that's a little bit more expensive at the grocery store, something like berries or avocados, or it's going to be something that is a little bit more unusual or challenging for people to work with. Something like butternut squash, for example. The winter squashes are always very challenging, or a full pineapple. Most of us aren't used to having to break down a full pineapple. So we like to make sure that we're keeping it comfortable for our customers, but also that we're introducing them to new things. So that's sort of the purpose that those recipe cards serve. The Fresh Food Box is available in 30 counties across the state through our network of hubs and partner sites. And I'll explain that a little bit more later in the presentation. But basically, that means we have 30 counties that have locations where you can go pick up a box. And if you live in a neighboring county that doesn't have a pickup site, you can certainly go, you don't have to be a resident of that county to access it. So we do actually end up serving every county in South Carolina. We just have pickup locations in 30 counties. And the coolest thing, and as if fresh produce isn't cool enough, the coolest thing about the box is it is super duper affordable. It is $20 for customers who are paying cash, and it is $5 for our customers who are using their SNAP EBT card. And I'll explain how we do that here in just a second if you want to go to the next slide. Perfect. Okay, so how it works. We utilize a bulk buying model. So we buy in bulk from a local produce distributor, Sun Brothers. They are a family-owned business working out of the West Columbia Farmers Market. A question that we get a lot is our produce local? While we do work very hard to try to incorporate as much local produce as we can, like for example, I think in the last box we had Cottle Farm strawberries. This week we have Watsonia peaches. So we do try to source local produce as much as possible, but it is not all local. If I invite anybody to tell me where local bananas or avocados are available in South Carolina, please. So, not thing is locally sourced, but we do utilize a local vendor. Family owned, has been in the Columbia area forever. We buy in bulk from them. So all of the boxes are pre-ordered. So we know ahead of time exactly the quantities that we need of each item that we're putting in the box. People pay up front for them. And then we work with Sun Brothers. They have a really lengthy list of things that they're able to sell us at a wholesale price. And then we sell them back to the community at that wholesale price. We do not make a profit on the box. I think there's like maybe $1.25 markup to cover the cost of the cardboard box itself. But we do not profit. Everything that all the money that people spend on the boxes goes right back into the next box, if that makes sense. That's how we're able to offer them at that really affordable wholesale price of $20 for one box. But we are able to offer it at a pretty significant discount to our customers who utilize SNAP EBT through a partnership with DSS. DSS runs South Carolina's SNAP program. They manage South Carolina's SNAP program. And in South Carolina, we have a SNAP incentive program called Healthy Bucks, where if you spend $5 on fresh produce with your SNAP EBT card, you get $5 back. And Healthy Bucks is available mostly at farmers markets and like roadside stands. The idea behind that is to keep those SNAP dollars in the local economy. So rather than going and buying produce maybe at Walmart and getting Healthy Bucks that way, the idea is to keep it in the local economy. So, supporting local farmers, supporting local growers. But we were able to work with DSS to become part of the Healthy Bucks program. Normally with Healthy Bucks, when you spend $5 on fresh fruits and vegetables, you get like a token back that you can then use to buy more fresh fruits and vegetables next time, which, is fine. But from our perspective, it does put it puts the burden on the customer, right, to keep up with that token, to make sure they don't lose it. So we worked it out with DSS where we get reimbursed directly. So we essentially eat the cost of the box up front. So, but then we keep a log and DSS reimburses us. So that way, even though we are paying $20 for that box that someone is buying for $5 with their EBT card, we get the $15 reimbursement from DSS. So it kind of takes the onus off of our customers, where they're able to just buy their box for $5 up front and not worry about any physical tokens or, any complications like that. It's a little bit confusing. So if anybody needs clarification on any of that, again, just drop something in the chat. I don't mind being interrupted. And then our box program runs off of our community partnerships. All of our hubs around the state are run through local nonprofits. So we give them sort of like a toolkit and the technical support to set up a FoodShare hub in their organization, but they run it. So for example, in Berkeley County, the hub there is run through Trident United Way. So they take their produce orders from Sun Brothers. They pack their own boxes. They have their own roster of customers. They have their own partner sites. They handle all of that themselves. We just provide sort of the infrastructure and the technical assistance. So we have 20 hubs around the state, and they're all run through these local organizations that know their communities well, that know what the community needs are. So by partnering with them, we're making sure that, our fresh food box program is tailored to the needs of those specific communities, because, communities in Berkeley County may not have the same needs, interests, or priorities as, box customers in Greenville County. So by working with these local organizations and letting them run their programs the way they need to, we make sure that those community needs are addressed. Next slide. So these are all of our hubs. This shows you sort of how they each came to be. So FoodShare celebrated its 10th anniversary this year, back in April. The first hub was in Richland County. Our second hub started in Greenville. Mill Creek Farms approached us, really liking the FoodShare model and wanting to know how they could do something similar. And that's sort of how the hub model was born. It was decided that rather than try to kind of reinvent the wheel, we provide them with the resources they need to start a food share hub within their organization. So then Ruth's Cleanings in Spartanburg caught on, and they wanted to take part in it too. And it kind of just grew and grew from there. So our newest hub opened last year in Anderson, which we're thrilled about. That was a long time in the making. So we're super, super excited to finally be serving Anderson County. And my program manager and I are actually going up there next month to work with them at a partner site to do a cooking demo and really, try to generate more enthusiasm for the box. Not that there isn't any, but we're really trying to make an impact up there in Anderson. So we're looking forward to taking part of that. We can go to the next slide. So another unique thing about the Fresh Food Box program and about FoodShare is we recently developed the ability to take SNAP orders online. This is a big deal for our SNAP customers. This is another way that we're able to expand access, especially to our SNAP customers. We do not currently have the ability to take online orders for everyone. So you have to either come to the hub in person to order your box and prepay for it, or you can pre-order when you come to pick up your box. You can always pre-order for the next one and pay then. But it does put a little bit of, the onus on the customer to get here in person somehow to pre-order and pay for their box. So by launching our SNAP online, we've been able to take that burden off of our SNAP customers, and they can now prepay for their boxes and place their orders online. We launched that here in the Richland Hub in December of 2023. It has since rolled out to 11 of our FoodShare hubs. There is a lot of technical behind the scenes that goes on with launching the SNAP online. So some of our smaller hubs that are in more rural areas and maybe don't have as much infrastructure have been a little bit slower to take it on because it's a little bit of work to set it up. But we're working with them to provide that technical assistance to get them rolling with it as well. And what makes us especially unique here is that we are the only community-based organization in South Carolina offering this option. So SNAP Online is available at major retailers' websites, Walmart, grocery stores, Instacart, things like that. But we are the only community-based organization in the state that offers SNAP Online, and one of very few in the country to offer this option for our SNAP customers. Okay, we can go to the next slide. So another one of our programs, that really promotes that food equity and that access. We get another question that we get a lot is, do we deliver? That would be so nice if one day we could deliver to all of our customers. But as any of you who have worked in nonprofit type of settings know, you do a lot with very little. So we just don't have the infrastructure, unfortunately, right now to deliver to everybody. But we do have a delivery program in our Richland County hub here in Columbia for our customers who are medically homebound. And that was in response to the number. So I think it's 29203, which is a Columbia zip code. I don't know if this is still the case, but at one time they had the highest rate of below the knee leg amputations in the country due to type 2 diabetes. I don't know if that's still the case, but the creation of the Neighbor Share program was in response to that statistic. So that is a delivery program for customers who are either medically homebound or just have medically related challenges with transportation or getting around. We offer that in Richland and Lexington counties right now. We have a little over 100, I think, Neighbor Share customers at this time. And we rely on volunteers. We create routes for our volunteer drivers, so that they're not having to run all over town. We try to map it and make sure that, they're delivering in one little cluster of town. But we rely on our volunteer drivers to deliver those boxes to our customers who are medically homebound. We can go to the next slide. Our VeggieRx program is another way that we address that health equity piece of it. So VeggieRx is literally a produce prescription program for patients with type 2 diabetes or who are at risk of type 2 diabetes. So we work with several clinics around the state to offer this program where their physicians prescribe patients with a fresh food box for 6 months. So, in addition to any kind of pharmacological or procedural interventions, that's sort of supplemented with a free fresh food box for 6 months. During that 6 months, the physician will track the patient's A1C, blood pressure, and weight, to monitor any changes there that are happening. And the goal of that is for reducing food insecurity and, of course, increasing those positive health outcomes and decreasing healthcare costs. So we do offer that in 7 clinics statewide. I do have another presentation that our VeggieRx program manager sent to me like yesterday. So Kathleen, I will send that to you if you want to post that along with these slides. It has more detailed like data about the VeggieRx program that I feel like some of the folks in this meeting might be interested in seeing. So I'll send that to you. It goes into more depth than I can in this presentation. We can go to the next slide.
That sounds great. Thank you, Kelly.
Sure. Okay, and I'm biased, but this is my personal favorite, Culinary Medicine. This is where I live. So this is another way that we sort of address health equity and food access from the academic and healthcare side of things. So I like to think of it as kind of like a preventative approach. But we, as I said, are a program of the School of Medicine, USC School of Medicine here in Columbia. And we offer an elective course called Culinary Medicine for our 4th year med students. Last year we offered 3 rotations of it, and I believe this upcoming year we've got 3 rotations on the books as well. It's a 4-week elective. We meet in the kitchen twice a week for 3 hours, and then we have a guest lecture day via Zoom on one of the off days. But what it is, it's basically nutrition basics combined with just interactive culinary skill building. They get all of that like good biochemistry stuff, in their core curriculum, the Krebs cycle and, all of that good stuff. But that's not really the kind of content that translates well when you're discussing nutrition with a patient, right? So we really get back to basics. We talk about, the nutrition facts label, how to read it, what does it mean? What's the difference between whole grains and, enriched flour? Why do we care about whole grains? Just really basic stuff like that you can easily translate to a patient, in the 10 minutes maybe that you have to discuss nutrition with them. And then we cook. We use a lot of really accessible recipes with affordable ingredients. We use a lot of recipe frameworks. Again, like when you have 10 minutes to spend with a patient, you don't necessarily have time to like go through like a recipe with them. But if you can give them sort of an idea of like, well, if you have X, Y, and Z types of ingredients in your pantry, you can throw together a stir fry, and that'll help, like, you'll get your fiber that can help lower your blood sugar, all that good stuff. So we're only one of 55 medical schools nationwide to offer this program, which is really exciting. It is just so much fun. And if any of you are in the Columbia area, I invite you to email me and come shadow a class sometimes. That's my arena. Like, these presentations always make me a little bit nervous because I'm not a lecturer. But I would love for anybody who wants to check out our culinary medicine elective to come shadow the class, because we have a lot of fun and the students are just so inspiring to see them in action. So anyway, I could spend the rest of this hour talking about just this class, and I'm not going to do that. So we're very excited to finally also be rolling out our Community Cooks program. That's actually happening right now as we speak. We are wrapping up our very first community program. We really want to offer the community cooking program as like a value add to the fresh food box. We have a lot of customers that have been receiving the fresh food box for years, and still aren't totally comfortable in the kitchen. So we want to provide opportunities for them to come into that 3,000 square foot teaching kitchen that Kathleen referenced at the beginning of this, and work with our wonderful community facilitators and you know, just learn how to cook and learn some tips and tricks. So this program that we are wrapping up right now was with one of our partner sites called Finley House. For those of you not in the Columbia area who may not be familiar with it, it is an apartment complex for seniors living on a low income. And they've been receiving our boxes forever, and they've been dying to get into the kitchen. And so we were so excited to finally invite them in for this 3-part series that we've been hosting once a month since April. It has been facilitated by Chef Floyd Jeffcoat. He is the culinary coordinator for the Richland County Library Northeast Branch. They're just around the corner from us. They have a teaching kitchen. Chef Floyd has been volunteering for FoodShare, packing boxes for years. So we're super excited to finally get him into our kitchen, you know, in his element, working with our FoodShare customers. And then in this photo that you see here, this was taken after the first class finished up. The young lady there on the left is Danny Harpin. She was one of my culinary medicine alumni. So she now she's a doctor. At the time, she was still a 4th-year medical student, but now she's a doctor, and she generously came in and volunteered to help with that class. So it was really fun seeing like all elements kind of coming together in that way. So next slide, please. Okay, so our impact. And some of these slides get kind of wordy, so I'm not gonna read them all to you guys. They will be posted later, so you can always go back and read them on your own time. But I do want to leave time for discussion, so I'm gonna try to move this along. But this shows you right here just the impact of our fresh food program, just in terms of the number of boxes and participants. So statewide in 2024, we delivered almost 100,000 fresh food boxes across the state. Again, through those 20 hubs and all of their partner sites, ultimately we were able to serve 46 counties. And so that's almost 12,000 participants in total, which is awesome. It's come a long way from those first 20 boxes packed in our founder's garage in 2015. We can go to the next slide. Next slide. Did I freeze? Oh, there we go. Okay. So these are just some highlights from our hub network. Oh, okay, awesome. So this shows sort of the impact of SNAP. So as you can see, what is that number? So it looks like almost 40% of our customers in 2024 were paying with SNAP EBT, which is a huge impact for our customers, you know, who are working on a limited budget. And then that other chart there shows the percentage of overall SNAP transactions completed online. We've had a really good response to the SNAP online. People love not having to leave their houses to order and prepay their boxes. You know, some of our customers, you know, particularly like some of the older customers are, you know, a little bit less comfortable with it. You know, so we've offered trainings for them to try to get them more comfortable. We've offered trainings where they can come in and actually work with our director of marketing, who is kind of the brains behind Snap Online. And he shows them in person how to get more acquainted with the platform. So that's worked really well too. So we're really excited that people have had such a good response to that. And we can go to the next slide. Okay, and then the impact of neighbor share. So as you can see, between 2023 and 2024, it's grown significantly. You know, we've increased to 149 participants, whereas last year we had just over 100. You know, we're up to 40 volunteer drivers who drive for us on a consistent basis. Which is how we're able to scale up that way and include more people in the program. You know, we've gone from under 1,800 fresh food boxes delivered to our neighbor share customers to over 2,000. And as you can see, most of those are going to be SNAP EBT customers. And, you know, through Snap Online, we've been able to increase that engagement as well. Next slide. And then VeggieRx. So here we've got our partner clinics listed out. And we have, these stats are based on the first 6 months, I think, of 2024. But you can see that like that first cohort that we had of participants in VeggieRx did manage to decrease all of those benchmarks, which is great. So there is, it shows that it does have some impact. Currently, we are in 7 clinics, and those physicians in those clinics have referred, they've referred 535 patients in 2024, and that amounts to almost 4,000 boxes. So that is hopefully helping those folks, learn a little bit more about how to eat fresh fruits and vegetables and increasing their food and nutrition security as well. Next slide. And these are just some more stats on VeggieRx. And I love those quotes. I know they're really long, but they are definitely worth going back and reading. It is a really meaningful program to our participants who graduate from it. They do learn a lot, and, they do find that, what people think of as healthy eating isn't necessarily as hard as maybe they thought it was. So you can go to the next slide. Okay, and culinary medicine. So as I said, last year we had 3 4-week rotations, and we've got 3 more coming up this academic year. Last year we had a total of 30 fourth-year medical students come through the class. So that's about a third of the graduating class. We're hoping eventually to add a 4th rotation so that we can attract, more and more, because the classes do have wait lists. Just a lot of, medical students have crazy schedules. So, I want to offer them as many opportunities to take the class as they can. It was a total of 96 total kitchen hours last year, and we had amazing guest lectures from the South Carolina Department of Agriculture, Cooley's Snap Ed, A More Healing Kitchen, which is a wonderful organization in Charleston, which, Kathleen, if you haven't looked into Amore, Maria Kelly, who runs that organization, would be an amazing guest for this series. And then Prisma Health, of course. And I love having these guest speakers because I want to be able to show the students, first of all, they don't want to hear me just yapping constantly, but I like to offer, other perspectives to really help them understand that the connection between food and positive health outcomes is it's more nuanced than just getting, healthy food into people's hands and teaching them how to cook it. There are a lot of other factors at play. And I love bringing in like these interprofessional interactions for them to engage with and ask questions and to really see like that bigger picture, hopefully. You can go to the next slide. And then we do a lot of advocacy work. Our executive director, Ome Salma Rahemtullah, she used to be the director of policy and advocacy here at FoodShare before she stepped into the ED role. And she is a policy and advocacy person at heart, and she continues to do that work, advocating for food access in South Carolina and nationwide. We do belong to a number of coalitions that work in food access advocacy. The South Carolina Anti-Hunger Advocacy Coalition, the Food as Medicine Coalition, Columbia Food Policy Committee, and a new one that was formerly the South Carolina Food Policy Coalition, I think, but they've sort of rebranded and are kind of changing their direction, and now it's the South Carolina Food Systems Network. You can go to the next slide. So these are some of our advocacy highlights from last year. So we were able to work with a lot of these coalitions and different organizations to improve food access. The one that I am the most excited about personally is joining the Opt-in Coalition in South Carolina, which is facilitated by Foster America. That focuses on providing resources for families who are at risk of being in the child welfare system. So we've been really excited to join that coalition because as I alluded to with food access, things like this are so multifaceted, and you have to take into account, all sorts of non-clinical factors. And, it's just really exciting to be a part of that coalition. You can go to the next slide. So, this is where I invite you to get involved if you have the time or the interest. We have all sorts of volunteer opportunities, the biggest one being packing fresh food boxes at your nearest hub. If you go to our website at www.foodsharesc.org, you can find the hub that's nearest you, and you can get in touch with them and find out what their packing schedule is, and you can go pack those beautiful fresh boxes of produce. We always need help at fresh food box distribution. We distribute, we pack 800 to 1,200 boxes a week here in the Richland hub. We're by far the biggest operation, being kind of the mothership, but a lot of the hubs around the state do pack well into the hundreds of boxes. And a lot of those go to our partner sites, but I would say we probably distribute about 500 of those boxes out of our front doors here in Richland County. So it's a big operation. We always need volunteers to come help us with distribution. And then if you want to drive for neighbor share, if you're, not as much like wanting to be, doing all that heavy lifting with packing or distribution, driving for neighbor share is a really wonderful way that you can help if you've got 2 spare hours, on a Wednesday or Thursday. That makes a big difference for our communities. And then you can be a partner site. So partner sites are basically pickup sites for boxes. So if your clinic or school or church or, wherever it may be is interested in being a site where people can come pick up FoodShare boxes, you can do that. We can arrange that. Just get in touch with us through our website and we can walk you through that. So next slide, please. Okay. Now, okay, I've left 17 minutes for questions.
Okay, so we welcome everybody, anybody who wants to unmute or put questions in the chat box, whichever you'd like. Please feel free to ask Kelly any questions or comments.
So I see a couple of questions here in the chat. So for the analysis of 339 VeggieRx patients, were those changes within 6 months or shorter time frame, and can patients re-enroll? So that was at the end of 6 months. So they get their fresh food box for 6 months, and that data was taken at the end of those 6 months. So that data that you saw on that slide was the resulting data from that first cohort in 2024. And unfortunately, they cannot re-enroll. I wish they could, but unfortunately it's a one-time thing for them. We hope that they continue to buy the boxes after their graduation, after their 6 months is up. But it's hard to get somebody to buy something when they've been getting it for free. So that's kind of a challenge that we're trying to navigate. My idea, and I would love any feedback if y'all want to email me any thoughts. My idea is to eventually develop a cooking series for VeggieRx graduates. But the rule is they have to be a fresh food box customer in order to come in and get that continued education in our kitchen. So that's kind of my idea to continue that customer engagement. But I don't know.
I love that.
Oh,
Kelly.
thank you,
for
Anne Louise.
sharing.
You're so sweet. I'm such a nervous speaker, so thank you. That's really sweet. Thank you. Any other questions? I know it's a lot of information to process. It's hard to know.
Kelly, this is Don. Obviously, it's amazing what you guys have accomplished. I can't tell you enough. But where does the funding come from for obviously even not only the solid the box component, which is your flagship program, but the expansions, etc. Success, difficult, easy, hard, state. I don't know. Tell
Yeah,
us.
funding is always funding's always the trick, isn't it? So we are very, very fortunate. We had a 5-year grant from Blue Cross Blue Shield's Diabetes Free SC initiative. That funding cycle actually ended on May 31st. But we got some funding extended from BCBS for another 2 years. It's not as much, but for that 5 years, BCBS was really funding the bulk of our operation. Now we're having to diversify a little bit because we're not receiving as much from them for this next 2 years. So we are working at, we're looking at a few different grants where right now the trick is finding funding for culinary medicine. So we've been looking at a lot of foundations, corporate foundations, things like that have a food as medicine focus. There are a lot of them out there, but it's pretty competitive, especially now with the federal funding landscape having shifted some. That philanthropic dollar is becoming a little bit more competitive. We had a great meeting a couple of weeks ago with USC's prospect research team. So they're going to start investigating like, some of their outlets, some of their sources, individual donors. Eventually, we would like to be able to, I'm going to need a bigger team for it, but we would like to be able to open the kitchen up for like event rentals, and or if there's like a local chef in town, who wants to do one of their programs in our kitchen, like offering a rental facility for them to use, which would generate a lot of revenue. You can make some good money by renting out a kitchen. It's a lot of work, but it can pay off. We just need a bigger team for that, because Lily and I can't do it all by ourselves. But we're right now pretty much fully philanthropically funded. But we're looking to diversify that. And Ome has just been working away at the prospect research and the grant writing and all of that good stuff. So if anybody has any leads on that stuff, feel free to send them my way.
Kelly, I don't want to hog all the question time, but since the regional cooperative is going to start expanding beyond South Carolina to North Carolina, it already is, Florida and Georgia, are you aware of any similar programs in other states? And if there's advice to individuals that are on the IECO today regarding starting from, we started from scratch, and you started from scratch. Thoughts on other states' programs? Similar, not similar, none? And then how did you even get started?
Well, I'm not aware of any other similar programs in any other states, but I will add the caveat, and I hesitate to say this out loud, but I haven't researched it as much as I should. But I'm not aware of any programs exactly like ours. There are, obviously like food banks and, organizations like that, charitable food organizations will offer, boxes. There are other types of organizations that offer other types of boxes, like, through whatever partnerships they have, but I'm not sure like how financially it's structured, like whether they have that SNAP incentive component to it. I'm just not sure. And that is honestly something I should be more about, and I'm a little bit embarrassed that I don't. But there are so many like really cool, innovative, like food as medicine type programs out there. The one that I always think of, and the one that I always, try to like rep as much as I can is a More Healing Kitchen in Charleston. I know that this presentation is not about that, so I won't get too much into it, but Maria, who runs it, does not have a background in nutrition, healthcare. She's a retired Spanish teacher, a retired high school Spanish teacher. But she started this amazing initiative that cooks plant-based meals, and delivers them at a lot of the time for no cost to members of the community facing serious health challenges. I encourage everyone on this call to look into it. It's a great organization. So there's a lot of like really innovative approaches like that out there. But I haven't seen anyone, to my knowledge yet, doing like a box with the SNAP component and all of that to it. Does that answer your question? Okay. And what was the second part of your question? I forgot it already.
If you had any advice to any of our participants in not only in the regional collaborative, but the IECO series, how do you start?
I mean, that's the hardest part, right? It's always like that first step. I mean, honestly, for me personally, I have 2 feet and they were made for just jumping right in, both feet first. My advice would be just do it. Just if you want to do it, you'll find a way to do it. Our founder, Beverly Mitchell, when she started FoodShare, she was a diabetes educator at Prisma. And, so she was finding that like a lot of the patients that she was counseling really wanted to follow her guidance. A lot of that guidance was like eating fresh fruits and vegetables. So they really wanted to. They had, their hearts were in the right place. But it was prohibitively expensive. They couldn't afford it. And they would come to her and say, Bev, like, I want to do this, but like, I can't. Like, I don't have access for, whether it's geographic access, financial access, whatever. I don't know how to cook fruits and vegetables, you name it. So, Bev, I guess, knew somebody at Sen Brothers. And so she just went to them and was like, hey, can I just buy a bunch of like wholesale produce from you and just sell it to these patients at wholesale prices? Like they can't get it otherwise. And so she, like I said earlier, she put together those first 20 boxes in her garage. Like FoodShare was run out of her garage at first, until Prisma kind of like, saw what was going on and realized like how innovative it was and came in and supported her with that. But like she just did it. Like it's all about those like, I always tell Lily is my program manager, and she's many years younger than me. So she's really just like starting out in her career, and she has a gift for like community partnerships and like connecting dots, and figuring out like who should be talking to who to like build really amazing programs. And I tell her, I'm like, and I tend to be kind of like an antisocial person. Believe it or not, I'm pretty introverted. So it's hard for me to just like talk to people, at events and stuff. But I always tell her, it doesn't matter. Like talk to everyone, like remember them, like remember little details, keep in touch, because those community partnerships and those like relationships that you develop, like they will carry you. Like anything you want to do, if you've got like this network of community partners who are you really attentive to and like really like working with you, you can do anything. Like we can do anything together. So that would be my advice. Just like cultivate and nurture as many of those community partnerships as you can, and then just do it.
Thank you, Kelly.
Yeah, of course. Who else? This is my favorite part. I don't like the lecture part. I love the question part.
Are there any other questions or comments, thoughts for Kelly?
I don't have a question, but I just have a comment. Wonderful presentation. And I'm going to be connecting with you the next time I'm in Columbia to visit. And then I would love to connect more to just know how a healthcare provider can join one of these programs.
Yeah, absolutely. Yeah, that would be great.
Right. Well, I just wanted to say thank you so much, Kelly. That was an incredible presentation, and we loved hearing about FoodShare South Carolina and all the different programs that you guys are doing. It's just inspirational. So we really appreciate you coming today and talking to us.
Thank you so much for having me. It's definitely an honor. I really appreciate it.
Well, thank you. I did want to share a quick preview of what our next Echo session is going to be. It'll be Thursday, July 24th from 12 to 1 like normal. And we are having the University of Mississippi School of Medicine back. Mina, who was here last time, will not be here because she is in residency. So as you all know, residency takes up all of her time. So Timothy Martin, who was here, he's coming back, and he will be also bringing some of the students from the nutrition services, and they are going to talk to us a little bit more about the different programs that the nutrition program and nutrition services area is doing over there. It's a great follow-up for today's conversation about food and chronic disease, and we really hope that you'll join us for another meaningful discussion. Keep your eye out for the inboxes, emails. Those reminders will come out, and we'll have the LinkedIn posts as the reminders also. I would like to quickly highlight the Constellation Regional Collaborative team that is behind this Echo series. Together, we support each other in the planning, outreach, and execution of each session, and we're so happy to have you guys here today with us. Please don't hesitate to reach out. We'd love to connect and continue any conversation, and we'd be happy to hear from you. The post-Echo series survey will pop up when I close out this meeting. So I will go ahead and close that out. It's just a quick 8-question survey that does allow us to improve the future sessions. If you are looking for your continuing education credits, you do need to complete this survey to get that 1-hour credit. If you would like, you can wait for it to pop up at the end, or you can use this QR code that's on your screen. We thank you in advance for your feedback, as it truly helps us to shape this series to better serve you guys. Finally, thank you all so much for joining us today. We appreciate your time, your insights, and especially the important work that you're doing in all of the communities that you serve. A great big thank you to Kelly again for such a fantastic presentation. And we hope to see you guys all on the 24th of July. We hope you have a great rest of the June and a great 4th of July holiday. Thank you.